Hi, everyone, and welcome. We have world-renowned technologist Denise Levy that's here with us. She is going to show us the difference between a normal result on a test for peripheral artery disease and what an abnormal test may look like if you are getting tested for poor circulation, mainly the legs, the arteries in particular. There's a difference between getting a test for your veins, getting a test for your arteries. We're talking about peripheral artery disease, or PAD, a disease more prevalent and deadlier than most cancers combined, but caught early. You get diagnosed early for those leg cramps, the neuropathy, the leg pain, leg fatigue, maybe some burning or tingling in your toes. You ask your doctor for an ankle brachial index where they put the blood pressure cuffs on your legs and your arms, measure the differential, and you'll know whether or not walking is the best medicine for you. I think it's great for everybody, but particularly those with peripheral artery disease. You need to walk, walk, walk to grow your natural bypasses around those blockages. So, with that being said, Denise, welcome. Thank you so
Ew.
much. We're going to take a look at an abnormal and a normal result of an ABI test. And a big thank you to Dr. Hill, Dr. Brad Hill and Minay Hill with Hill Vascular in Campbell, California, for providing these results so we can show the difference between the two.
Okay, the first normal was a patient that had an ulcer. Patient non-diabetic came in 47-year-old non-diabetic, non-smoking, history of hypertension. So what we wanted to do is see if she has combined disease. And her brother had an aneurysm with bypass. So this is why they sought consultation. You can go down.
Okay.
We
But
have no
immediately you're looking at it and you're seeing here's a 47-year-old non-diabetic, non-smoking female. So what are you thinking in this moment when you're seeing they don't have the typical risk factors?
Well, she does have cramping and she
Mhm.
has an ulcer. So we
Okay.
want to see, is the ulcer venous or arterial?
Gotcha.
Um,
Okay.
so she's normal ABIs and she has a normal um, pulse volume recording, which is what we do to confirm all levels. And as you go
Okay.
down, um, look at these wonderful waveforms. You see, we call this triphasic, where it goes up, down, and back up again.
Okay.
So this is a nice normal waveform, plus the toe, the PPG, the plethysmography on the toe is nice, and it has a notch in the waveform as well. So all these numbers are normal. Um, and the toe is 8.9 and 9.9, so that's normal as well. And if you go down, further down, you'll see. Now, this is what we take history on. So, smoker, no. Hypertension, yes. We go through all of these questions on every patient um, so that we can get a good history.
Mhm.
You can go down further. That's normal ABI. And
What is normal? What makes this a normal ABI? What do these numbers tell you? Because you
well,
have the
anything one or above is normal. So the posterior tibial, the dorsalis pedis on the foot, and the the TBI has to be above 0.5. So those are all normal. And the waveforms were triphasic, supernormal. And
okay.
I believe there is a PVR.
And what's a
There,
PVR?
that's the pulse volume recording.
Okay.
So everything is multiphasic. It's triphasic or multiphasic, multiple waveforms. So that's all normal. That's ABI. Now, if you go down, I'll show you what a normal PVR looks like. And we do this at
Okay.
the low thigh, the calf, the ankle, and the toe. So look at this. These are very nice waveforms. There is a notch right there. Um, as
Where are
the
we
peak
looking?
comes down, you see the notch there. That's only found in a normal patient. So in an
Okay, where's the
abnormal
notch?
patient,
Right
there's a
here?
notch. I don't know if I can point to it. Can you see my pointer?
Do you see my pointer? And then you can tell me where to move it.
There's a notch right there.
Right here. That's called a
Yeah,
notch.
that's it. That's it.
Okay. Okay,
It goes
cool.
up,
Okay, that's
down,
good to
and
know.
there's a notch. So these are where the cups are placed, the lower thigh, the calf, the ankle, and then the toe. So that's a normal PVR.
Okay. All the way
And
down
it's a
to
simple
the
test to
foot.
do. It only takes like 10 minutes at the most.
And
And we
how do
do
you know
this.
in a situation like this particular patient that is 47 years old, you could imagine that if she had valvular issues, I was looking at her history, that open heart valve surgery, that we have had a patient on here before. We've had Jim on here before. I've also dealt with another patient, Benny, who also had valvular issues. And in those situations, they were throwing clots down both legs. And so in
Mhm.
those situations, you might believe that even if they're not a diabetic, they're a non-smoker, that with valvular issues, is there a possibility that clots may have streamed down and caused issues in their legs? In this case, would you have asked the patient to do an additional test, an ABI test, where they exercise first and then see if the pressure drops? Or do you think conclusively that this is a normal result?
Well, she didn't complain of claudication. She only
Okay.
complained of cramping and possible wound. Um,
Well, I would
so
think that with those that that might indicate that
yeah,
there might be something further.
yeah, yeah. So I would say that I wouldn't exercise this patient because she wasn't having claudications issues, and her waveforms are so normal that I probably wouldn't consider any further on this
Okay.
patient.
So here is the abnormal
Abnormal. Now, this patient is only 54. Is a diabetic, former smoker, and has kidney disease.
end
And
stage. Wow.
one and drops with claudication, one block. So we're looking at some pretty substantial disease here. So the resting pressure is 0.54, which is moderate to severe, and the toe is 0.31, which is severe. Anything below 5, anything below 3, sorry. Um, and the waveforms are monophasic. There's only one signal coming up, which is straight up going down.
Okay.
There's no. So let's
Do you,
look at this. See,
do you want me to?
so there are your
Okay.
risk factors: prior smoker, hypertensive, no ulcers, hyperlipidemia, no prior surgeries, yes on diabetes, uh, no breast pain, and has claudication, no gangrene.
Mm.
So this patient is moderate to severe, and the left posterior tibial at the ankle is occluded. It's chronically occluded. And in that case, I picked
Okay.
up the probe to make sure that it was really occluded and that I just wasn't missing it. And we always say confirmed on duplex that it's occluded.
Okay.
And if you go
And
down
when you say
further,
confirmed on duplex, that's where you pick up the wand. You put a little gel
I
on
image
there
it.
on the skin.
Right, because all these other pressures are non-imaging. It's a pencil probe to get a continuous wave Doppler. So here is my guidance that we always put this on every patient so that everyone can see this is the diagnostic criteria that we use.
Mhm.
And this is from IAC as well. So you can see that anything like moderate, 0.4 to 0.7. So he falls in that category. And then the toe is anything below 3 is severe.
Okay.
If you go down a little bit, you'll see there's the whole thing with the occlusion is absent on the left posterior tibial, monophasic, none of the waveforms are normal. The waveforms are showing proximal occlusive disease. When you get that kind of waveform and that kind of pressure. And go down a little bit more, you'll see the waveforms.
And I would imagine if it says severely abnormal waveforms, that's not a good sign.
There you go. See? Look
Oh,
at that.
okay. So these are very different than the one before.
Yes. See, those are monophasic. It goes up and comes down. There is no three components to that waveform. And if you look at the PPGs on the toes, look how almost flat they are.
Yeah.
So these are grossly abnormal waveforms, and there is an absence in the left posterior tibial. So yes, this patient does need a scan. Um, I wouldn't exercise this patient because they're already at moderate to severe.
Mhm. Yep.
So this patient would need a full scan first and then an angio.
So in a situation like that, as we said, we always say that the doctors don't just treat based on the imaging alone. It's the symptoms. And in this case, we have a patient that can only walk or barely walk one block
One
without
block.
having to stop. And
Correct.
so in these cases, that's where the doctor will have a discussion with the patient about what other options might be available, whether it's intervention or surgery.
Correct. Yeah. So you
Thank
can
you
see
so
the
much,
difference,
Denise.
big contrast between, a 47-year-old and then a
Yep.
54-year-old with multiple risk factors.
And I still wonder with that 47-year-old, you're imagining that it could be something that might be venous, and that could explain issue that the patient is having with the wound that won't heal.
Correct.
Thank
Correct.
you so much, Denise. Every
You're
week
welcome.
we are looking at different test results for peripheral artery disease. If you want to submit your case and have us go over your results just to explain what the terminology means and to help you sort out what questions you need to ask your doctor during your consult about those results, go ahead and email us at info at padhelp.org. You must be present during our session with Denise in order to have us go over your results, because we are not here again to diagnose. We're not here. We're not treating you. Always make sure you do talk to your doctor before acting on any information provided here. Get their explicit consent, because this is not a diagnosis. This is not advice. Okay. But make sure you do like this video. It is so important. We want to get the word out there about PAD. And if you like the video, and maybe just share it as well. More people, more than 70% of Americans don't even know that PAD exists. And yet 1 in 5 people over the age of 60 has it. 3 in 5 heart attack sufferers have it, and most people just never know until they're faced with a heart attack, a stroke, or amputation is looming. So make sure you get checked if you have leg pain, leg cramps, neuropathy, numbness, or tingling in your feet, or even if you have a risk factor, history of smoking, diabetes, chronic kidney disease, heart issues. Make sure you do ask your doctor about a peripheral artery disease test. And don't forget, subscribe to our channel and click the little notification button for more great content like this.
Thank you.